You brush your teeth twice a day. You floss when you remember. You visit a dentist twice a year. And last month, you still found yourself lying on a bathroom floor at 3 a.m. with a toothache so bad you would have paid someone to remove your entire jaw with a hammer. Now imagine that pain with no dentist, no anesthesia, no ibuprofen, no ice pack, nothing. Before modern dentistry, tooth pain was not a medical problem, it was a survival problem, and your ancestors dealt with it in ways that will make you grateful for every single trip to the dentist you have ever complained about. The first thing you need to know is that your ancestors had different teeth than you. Not genetically, they had the same enamel, same roots, same nerves, but their teeth wore down faster and decayed slower. A 2014 study of prehistoric skulls found that hunter-gatherers had almost zero cavities. The reason is simple. They did not eat sugar, no candy, no soda, no bread made from refined flour. Their diet was meat, roots, nuts, and wild plants. None of it promoted decay. But they had a different problem. Their teeth were ground down to the nerve. Stone-ground flour contained tiny rock particles. Sand blew into their food. Chewing raw bones and tough meat wore enamel away over decades. By age 40, many hunter-gatherers had teeth worn so flat you could see the yellow dentin underneath. And when the enamel is gone, the nerve is exposed. Every bite becomes agony. So what did they do when the pain became unbearable? Sometimes they did nothing and hoped it passed. Sometimes it did. Sometimes it did not. Sometimes the tooth became infected, an abscess formed at the root, the jaw swelled, the pain became a constant drumbeat in their skull. They stopped eating, they stopped sleeping, the infection spread to their bloodstream, and they died. This was how your ancestors died from a toothache. It took about 2 weeks from the first swelling to the last breath. But not everyone accepted that fate. The ancient Egyptians had a surprisingly advanced approach. A papyrus from 1550 BCE describes how to treat a loose tooth. You mixed flour, ground barley, honey, and yellow ochre into a paste. You pack it around the tooth. The honey killed bacteria. The clay reduced inflammation. It was not a cure, but it bought time. They also had the first known toothpaste: crushed rock salt, mint, dried iris flower, and pepper ground into a powder. You rubbed it on your teeth with your finger. It was abrasive, it was painful. It was also the best they had. The ancient Greeks went further. Hippocrates described tooth extraction techniques in 400 BCE. You sit the patient down, you grab the tooth with metal forceps, you pull. That was the entire procedure. No anesthesia, no sterilization, no one holding your hand. The forceps were called odontogra, which translates roughly to tooth grabber. The name did not inspire confidence. The Etruscans, who lived in what is now Italy, were even more advanced. They made dental bridges and partial dentures from human teeth and gold as early as 700 BCE. They would file down neighboring teeth and attach a replacement using gold bands. It was painful to install. It was uncomfortable to wear. It was also the best dentistry in the world for over 2,000 years. The ancient Romans borrowed from the Etruscans. They used gold wire to tie replacement teeth to their neighboring teeth. The replacement teeth came from dead people or from live slaves. A Roman with money could buy a tooth from someone who needed money more. The tooth was wired into their mouth. It did not work well. It was better than having a gap. A 2001 archaeological dig in Pakistan found something that changed the history of dentistry. 9,000 years ago, someone in the Neolithic village of Mehrgar drilled holes into their neighbor's teeth. The teeth showed wear patterns consistent with a bow drill. The same tool used to start fires was used on human mouths. The drilled holes were perfectly round. The patient survived. Multiple teeth showed evidence of healing around the drill sites. Someone held still while another person spun a flint drill bit into their tooth with a bow, and they lived. If you have ever sat in a dentist's chair gripping the armrests during a routine filling, imagine Mehrgar. In medieval Europe, tooth pain was treated with prayer, leeches, and pulling. Barbers were also dentists. You went to the same person who cut your hair to pull your tooth. The barber surgeon would grab your tooth with pliers while you sat on the floor between his legs. There is a reason medieval skeletons often show missing front teeth. In traditional Chinese medicine, they used acupuncture for tooth pain. A needle in the hand, the cheek, or the ear could reduce the pain signals reaching the brain. It actually worked.
Not as well as Novocain, but better than nothing. They also used a paste made from arsenic and honey applied directly to the decay. The arsenic killed the nerve, the honey slowed the infection. It was a desperate treatment for a desperate problem. Sometimes it worked. In Slovenia, a 2012 analysis of a 6,500-year-old jawbone found traces of beeswax on a cracked tooth. Someone had heated beeswax and applied it directly to the exposed nerve. The wax sealed the tooth from air. It reduced the pain. It was a filling made of bees' sweat, and it worked well enough that the person chewed on that side for weeks after the treatment. In the Arab world, a 10th century physician named al-Zahawi invented over 200 surgical instruments, including specialized dental tools. He described how to lift a tooth with a lever before pulling it, reducing the chance of breaking the jaw. He also used catgut for internal stitching, a material that would not be used in the West for another 800 years. Your ancestors also had natural pharmacies growing around them. Clove oil contains eugenol, a natural anesthetic that numbs tooth nerves. Willow bark contains salicylic acid, the active ingredient in aspirin. Honey kills bacteria. Garlic fights infection. A crushed clove pressed against a rotten tooth could reduce pain for hours. A wad of willow bark chewed slowly released pain relief into the bloodstream. Your ancestors did not have a pharmacy, they had a forest.
But here's the part that stays with you. Even with all these remedies, tooth pain killed people. It killed them regularly. It killed them up until the early 20th century. Before antibiotics, a tooth infection could spread to the jaw, then the neck, then the blood. It was called Ludwig's angina. It killed people in weeks, and there was nothing anyone could do except watch. The next time you sit in a dentist chair and hear the drill start, remember, you are paying someone to gently fix a problem that would have killed your ancestors. You will walk out with a numb mouth and a small bill. They walked out with a missing tooth, a mouthful of blood, and no guarantee they would survive the week. The drill is loud and scary. It is also the sound of you not dying. The next time you complain about the taste of toothpaste, remember what your ancestors used. Crushed rock salt, mint, and dried iris flower, ground pepper on your gums. You have a choice between mint gel and bubblegum paste. They had a choice between chewing a stick and losing their teeth by 40. The stick was called a miswak, a twig from the Salvadora persica tree chewed at one end until it turned into bristles. It has been used for over 7,000 years. It is still used today in parts of Africa, the Middle East, and Asia. It contains natural antibacterial compounds that kill Streptococcus mutans, the main bacteria responsible for cavities. It is free. It grows on trees. The World Health Organization recommended it in 1986 as an effective tool for oral hygiene. You pay $6 for a plastic toothbrush that will end up in the ocean. They broke a twig off a tree and had better breath than you. You have toothpaste with fluoride, whitening agents, and breath fresheners. They had crushed rock salt and mint, and their teeth lasted longer than yours.